Those are the bloodiest attack in such a very long time. Yesterday only 141 Palestinians were killed and around 400 others were injured. Some of them are still struggling to survive because of their severe injury, the way they were targeted, the location that was targeted, the people who were in that area. That is extremely overcrowded area with people who are marketing, selling and buying, and staying in tents also was critical for the increased number of people who were killed. And since the morning, around 30 Palestinians were killed. In the latest incident, 13 Palestinians were killed in an UNRWA school that is used by shelter in a Nuseirat refugee camp, the refugee camp that saw another bloody incident a few days ago, and today 13 killed and around 101 injured. They were taken to a nearby hospital or medical center, Al-Auda Medical Center, and some other were sent to Al-Aqsa Hospital in the Deir al-Balah area. Days are getting bloodier for the Palestinians. The number of Palestinians killed and injured is increasing exponentially in the last few days. The hospitals are struggling to cope. I have spoken to the medical director of the Mubarak Hospital, one of the hospitals that were maternity and child hospital that were just evacuating the mothers and the children for the sake of securing a temporarily a decent place for the ones who are injured. They received 200 Palestinians in few minutes, and they received around 400 Palestinians in the 4 hours following the incident. The deadly incident that took place in Khan Yunis, and they have made a very special press release and a statement saying they will no longer be able to deal with any increase in the number of the casualties, which means people would be dying because of that. And they have also been struggling when it comes to the medical capacities, to the devices that are needed for the sake of just catering to the needs of the people. When it comes to pharmaceuticals and the spaces, the Israeli occupation controlled the premises of Nasser Hospital for around 2 months and a half, and because that, for instance, the dialysis department was totally burned, the reception and emergency was extremely affected, and the administration building was affected. So they are living an extremely challenging area in an area that is extremely affected by the ongoing war, and they are afraid they will not be able to deal with the large number of people who are injured and killed. They have already been struggling to cater to them, but they are afraid they will not be able to continue that anymore. So that leaves the Palestinians with the imminent death, not only because of the strikes that have been injuring and killing them, but rather because of the inability of the health system to address their needs and to treat them.